This is Dr. Anderson with North Texas Plastic Surgery, and today we're talking about one of my favorite topics, the mommy makeover. In this setting, what we're going to talk about is more of the preparation or getting ready for way from the front end, consultation process, all the way getting ready for surgery. So one of the kind of most basic questions that I'll get is, what is a mommy makeover? So really, it's an all-inclusive term that more or less means you're getting a couple of different procedures at the same time. For the majority of women, what that's going to mean is a breast procedure and a body procedure. So usually, as far as breasts are concerned, there's a few ways it can go. A lot of times, the women that are coming to see me, they've gone through these pregnancies, changes of breasts have happened. A lot of times there's drooping, so we're going to do some sort of lift. And then depending on where we're at with volume, if there's not enough, or too much, that helps us determine what we're going to do. So from breast standpoint, frequently lift, sometimes lift with implants, sometimes lift alone, and sometimes lift and reduction. So depending on what your concern is, how you're feeling, what you're not liking, what you're liking, that'll help determine what we're going to do as far as breast procedure is concerned. Then for the body procedure, usually that's going to mean a tummy tuck and most frequently liposuction along with it. Now there's several types of tummy tucks. I've talked about this before, and again, depending on what your concerns are, we'll discuss whether it's a standard tummy tuck, extended tummy tuck, circumferential tummy tuck, in a very, very limited subset of people, mini tummy tuck, any variety, depending again on what your concerns are and what we need to address for you. All right, so you've decided that it's time to get more information and really explore this further and in more depth. So the question is, what do I do next? The easiest thing for you that's going to be most time efficient is go to our website. It'll be linked below, and pretty quickly you'll find that you can fill out some information to get into contact with our lead team, who will help guide you and get some basic information from you to help guide that process so we can head toward consultation. A lot of folks, when they're getting ready to see me and consult, are very nervous. And I get this. Like, you're coming in, I'm asking you to tell me like what you don't like about yourself. You know we're gonna have to take a peek at things, but I'm gonna tell you, we have a lot of experience with this. We are very understanding that it's a very vulnerable thing for you to have to do, so we try to make it as comfortable for you as possible, knowing that we can't take away all those nerves and everything, but we can be empathetic and really try and help make it like an uplifting, empowering experience, as opposed to something that's just gonna stress you out even further. So the way the consult works is, first off, I'm gonna have you start talking with one of my nurses. She's gonna help assess those issues that you're having. We can help figure out, like, if you're gonna do an implant, what size implant may work best for you. She can answer any of those initial questions so we can really get the ball rolling and figure out which subset of things that we wanna be working on. From there, she'll talk with me. We'll work on 3D imaging of results that I think we can achieve with you. Now with these, they're of course not meant to be exact, but they do help us further our conversation to make sure we're going in the right direction. And you'll get access to these images as well. So if you want to, show your husband later on, or your sister, your girlfriend, whatever it may be, you do have that available to you. After she talks with me, we make the images, I come chat with you, we go over absolutely everything, I answer any question you possibly have, we look at those images, go through everything, and make sure that we have a really good firmed up plan. After you get done chatting with me, you'll talk with my coordinator, who goes through my schedule, pricing, timing, and all the kind of business end aspects of things. Other questions that folks ask are like physical preparation, what they can do with their body to get ready for surgery, and then maybe some medical and administrative things they can do to get ready for surgery. So as far as getting your body ready yourself, things that you can do, I always tell people the best time or place to be in with your body for surgery is as close to what your goal weight is as possible. So the stuff that we're gonna do isn't going to move the scale as much as we would like. Like, people wanna have a tummy tuck and come out 20 pounds lighter. That's just not the case. So ideally, I want you to be very close to where you are, so that way we're not trying to lose a bunch of weight after surgery and then have the potential that all this stuff that we've got nice, tight, and snug then potentially looks a little loose again. Like, we've spent a lot of money, a lot of time, a lot of effort getting there, and we don't want to have that not the best result that we can possible. So people will ask, okay, do I need a special diet? Do I need a special exercise program? So as far as diet's concerned, I don't require a very specific special diet. I want you to have that kind of healthy, balanced diet that we know we're all supposed to be eating and yet kind of don't and struggle with, but we do our best, right? So some people will say, do I need to have like a strict protein diet? Do I need to do super calorie restriction, whatever? I think a lot of that stuff, if you're trying it, it's not gonna last long term. So we need to do something that's sustainable and gonna help you maintain your results. As far as an exercise program, I always tell people the people that exercise do the best after surgery. The people that say, oh, well, you know, I got some lipo, so now it's just tacos and margaritas all the time. Their body will accept growing fat again in the future. So if you have exercise program that you get on before and you're doing that healthy diet, maintaining a healthy lifestyle, that's gonna help you get a better result that you maintain for a much longer time. Fortunately, something that I'm seeing less and less of that is hugely important is smoking and the use of nicotine products. So something I tell folks, I only do surgery that people want. I do not do surgery that people need. So if we're gonna do that, we have to have you set up for the highest likelihood of success and the least likelihood of complications. So one of those things is we absolutely have to stop smoking, and we need that about a month before surgery so all the nicotine can get out of your system. Now, if you're trying to be sneaky and say, oh, well, I just vape or I just chew the gum or whatever, it's the nicotine in those products that's causing the issues. And I won't bore you to death with the details, but the long story short is nicotine causes our tiny blood vessels to clamp down. Those are the blood vessels that go to the edges of the incisions that actually help those incisions heal. So if we have that nicotine in our system still, those blood vessels are not allowed to get to the edges of the skin, and we have a higher likelihood of wound complications, which I just described we absolutely do not want. We want to minimize that risk as much as possible. We're going to continue that smoking, nicotine, stopping, hopefully forever after surgery, but like, I live in the real world. I understand people are going to start back up again. We need at least another month, month and a half afterwards so that we can maximize our healing results. As I mentioned, I'm only doing surgery that we want to do, not surgery we have to do. So part of that is optimizing you. We already talked about diet. We talked about exercise. We talked about stop smoking medically as well. So a lot of folks are going to require a medical clearance from their primary care provider before surgery. They help look over everything as well. So we have an extra set of eyes that's ensuring that you are optimized from a medical standpoint prior to surgery. So what does that mean? A lot of times there will be lab work. So we test levels of things in your blood. We do EKG to make sure your heart rhythm's what it's supposed to be. So those things that can be a little more common, if there's something that comes up, fortunately it's not too frequent, that we can take care of it and optimize it beforehand, again, so we can reduce the risk of you having problems after surgery. As far as medications are concerned, I'm going to give you multiple medications that do multiple things. So we have all of our different pain pills. And the reason I say all of our different pain pills is because we're going to do what's called a multimodal pain regimen, meaning these different pain pills are going to hit on different pain receptors. So we're treating it from multiple different levels. So hopefully we can take fewer narcotics, which, don't get me wrong, narcotics work great, but they have multiple side effects, especially constipation, that can be very uncomfortable. So if we can minimize the use of those, that's wonderful. In addition, there's going to be an antibiotic. We usually will have a few days of a blood thinner so we can minimize our risk of blood clots, and then a couple other things in there to help ensure that we're healing as good as possible. Other people love to ask me about anesthesia. For this and almost every single procedure I do, we will do general anesthesia. That allows me to get you a much better result with a much higher level of your comfort. Now, I understand anesthesia sounds scary. And I think a lot of times what I hear talking to women, you know, I have a wife, I kind of understand this to some extent. I'm not gonna say I understand women, but I understand this a little bit, is we don't like that lack of control. And then you've always heard a story about something going on with anesthesia that seems less than desirable. So the little joke that anesthesiologists will always say is it's technically safer to undergo anesthesia in your procedure than it is to drive to the surgery center. So again, it's very safe. I'm gonna harp on this probably in every video you ever see of me. We are doing everything we can to maximize your safety and take care of you during these procedures. So let's go over some practical considerations when it comes to things to expect in the kind of very leading up to surgery, how to get ready in your life, and then what to expect like right after surgery as well. So as far as time off goes, safe bet is taking about 3 weeks off. Now, if you're somebody that's working from home, a lot of times people will feel okay at 2 weeks, and to some extent it's just dependent on how quickly you are feeling up to it. The kind of absolute thing I say is when you're off narcotic pain medicines and you're feeling up to it, that's when it's okay to go back to work. Now, you're still gonna have lifting, pushing, pulling restrictions. So I operate on a lot of nurses that are maybe having to move patients around. It's okay if you go back, but we're gonna make sure that we're not doing things that we've already talked about that we're not supposed to be doing. How to prepare your house. So in a perfect world, you don't have to go upstairs when you go home, but if you do, so long as there's somebody that can help you up and down and you're not trying to go up and down 10 times a day, it is okay, just so long as we can be super safe. But it's a little bit easier if your bedroom or guest room, or you can set up the living room, at least for that first week, to have that, so you're just not having to move around. I want you moving around some, but we don't want to overdo it in that very first week while mobility is a little bit more tricky. As far as a setup, like some people these days, they have these adjustable beds so you can have the back up and the feet up. A lot of people don't. So the easiest thing there is a couple pillows behind your back, a couple pillows under your knee, and that's gonna allow you to be in that flexed position. Or if you have a reclining chair, those work really well for people additionally. Let's be honest with ourselves and talk about one of the less glamorous things. So this is surgery, everybody heals different, and there are potentially complications that can happen after surgery. So I tend to think about complications more of, like if we're doing a breast procedure and a body procedure, breast complications versus body complications. Fortunately, any complication that you have, I will take care of you, we will get through it, and it will be okay in the end. The vast majority of people, even if they have something go on, doesn't affect anything long-term. So the most common things I'll see if we're separating breast and body, for breast, if we've done some sort of lift and we have an incision that comes together on the under portion of the breast, is just a little bit of skin separation or maybe a stitch pops through. This can be really, really stressful for you. And trust me, I don't like to see it, but we do some very careful wound care. We keep things clean and dry. We apply a little ointment, and usually within a couple of weeks, that's healed up really well and it just fades into the scar. And it's something that we know we were really stressed about for a while, but long-term, we're like, oh, that really wasn't that big of a deal. The other thing, probably the second most common thing that I would see as far as breasts are concerned is if we get a little spot of redness somewhere that comes up and we're suspicious or worried about a skin infection. If that's the case, you're going to let me know early on, and we're going to be pretty aggressive with treating with antibiotics. And most of the time, the absolute vast majority of the time, that will clear up with a short course of just antibiotic pills. Something that we may see earlier on in the, like right after we go home recovery process, is if nipples and areolas aren't the exact beautiful shade of pink that we want them to be, I send almost everybody home with some gel. We'll put that gel on, and it just helps promote healthy blood flow and gets those things healed even faster. I jokingly tell people I'm really greedy and I want you to sail through this without issues, so sometimes we do things to get them to go even faster. So then, if we're going to talk about tummy complications, the thing that I see most commonly there is after your drain tubes come out, and trust me, I know we hate the drain tubes, but they serve a purpose. We have to have them. At least we're going to say that for right now. I don't do drainless tummy tucks at this point in time. After those come out, if your body's still producing a little bit more fluid than it can handle, you get this internal fluid collection. We call that a seroma. Seromas are annoying, but they don't cause problems long term. The reason I say they're annoying is because we have you come into the office sometimes 2 or 3 times a week. We numb you up and we withdraw that fluid manually. We do that until it's sufficiently low that we don't need to do it anymore. And it's just the return trips to the office. Don't get me wrong, we love to see you. Hopefully you love to see us, but it is an interruption of your day to have to come into the office. Again, probably the second most common thing I'll see with tummies is a little bit of redness somewhere along. And like I said, we're really aggressive with treating with antibiotics, so we can knock down any potential skin infections there. The third most common thing that I see is where we have your belly button insets, which, trust me, we can link to this other video I made about belly buttons. That's like one of the very most important things about the surgery, so that we don't have this like big obvious thing that we had a tummy tuck. We want it to be discreet as possible. But it's not uncommon for a little stitch to pop through the skin and we get some white stuff that our body's producing. That's not pus. It's almost never infection, but your body produces this stuff called fibrin because it's trying to heal. So we have you snap a little picture, you send it over the Clara messaging app. We go through things. If you need to come into the office, we have you come in. We take care of that and it heals up almost always without issue. Now, if you're like a lot of folks, you're like, well, but what if there is something more long-term? So the thing that I would see the most long-term is people having a little spot of scar that's just not quite as beautiful as everywhere else. So in the intermediate term, we like to do a lot of injections to get your body's scar response to kind of calm down so that scar can fade in nicely. And then kind of worst case scenario, if still 3-6 months after surgery, it's just not as beautiful as we want it to be, we can do a little touch-up scar revision in the office. And this has been Dr. Anderson with North Texas Plastic Surgery. If you liked this content, please like, comment, subscribe below, and check across all social platforms. We're posting it there too.